11 signs of diabetes that few people know. In today's video, we will explore important health issues in people with diabetes. Did you know that itchy skin can be a sign that your glucose levels are not well controlled? That's right, and throughout this video, we will delve into how seemingly simple complications can indicate larger problems in your health. Let's start by discussing why diabetics suffer more frequently from conditions like nocturia and what this can mean for your quality of life. Have you ever thought about how a constant interruption of your sleep can affect your next day? Additionally, we will address blurred vision, a common symptom. But do you know exactly why this happens and what can be done to prevent permanent damage to your eyes? And speaking of symptoms, how about we explore more about restless leg syndrome and its connections with diabetes? Get ready to discover how these signs can help you better manage your diabetes and prevent future complications. Let's go! 11 signs of diabetes that few people know. 1. Itchy skin. Itchy skin in people with diabetes can be caused by various factors related to the condition. One of the main reasons is high blood glucose levels, which can cause skin dryness. This dryness occurs because excess sugar in the blood can lead to dehydration, as the body tries to eliminate the extra sugar through urine, a process that also removes a large amount of fluids from the body. The skin, deprived of these essential fluids, becomes dry and prone to irritations and cracks, which cause itching. Additionally, diabetes can affect blood circulation, especially in the capillaries that nourish the skin. Poor circulation reduces the body's ability to heal small wounds and skin infections, increasing the risk of skin conditions that can cause itching, such as fungal and bacterial infections. These infections are more frequent in diabetics because the high sugar environment in the blood favors the growth of fungi and bacteria. Therefore, itchy skin can be an indication that diabetes is not being well controlled. It is crucial to maintain good glucose control, hydrate properly, and care for the skin to prevent and minimize itching and other skin problems associated with diabetes. 2. Nocturia. Nocturia, although less known, is a term that describes an increase in urination frequency during the night, particularly common in people with diabetes. This increase is typically caused by elevated blood glucose levels, which the body tries to eliminate through urine. The result is frequent sleep interruptions, which can lead to fatigue and reduced alertness during the day, signaling that blood sugar levels are not ideal. To manage this condition, it is crucial to continuously monitor blood sugar levels and adjust fluid intake at night. If the problem persists, it is important to consult a health professional to explore other potential causes. This approach not only improves sleep quality, but also serves as a vital indicator for maintaining overall health in diabetics. 3. Blurred vision. Blurred vision in people with diabetes is often a reflection of fluctuations in blood glucose levels that affect the eyes. Essentially, when the blood glucose level is too high, it can cause temporary changes in the shape and focusing ability of the lens, the natural lens of the eye. This happens because excess glucose in the blood leads to the accumulation of fluid in the lens, causing it to swell and change shape, thus altering the focusing ability, resulting in blurred vision. These changes are usually temporary, and vision may return to normal once glucose levels stabilize with proper treatment. However, if diabetes remains poorly controlled for long periods, the risk of permanent damage to the blood vessels of the eyes increases, which can lead to more serious conditions, such as diabetic retinopathy. Diabetic retinopathy occurs when the blood vessels of the retina, the layer of tissue at the back of the eye that captures light, are damaged, potentially causing permanent vision loss. Therefore, it is crucial for diabetics to maintain strict control of blood glucose levels and undergo regular eye exams to prevent long-term eye complications. 4. Restless leg syndrome, RLS. Restless leg syndrome, RLS, is a neurological condition that manifests as an uncontrollable urge to move the legs, often accompanied by uncomfortable sensations such as tingling, itching, or crawling. These symptoms tend to worsen during inactivity, being more intense at night, which can be particularly problematic. In people with diabetes, RLS is often related to peripheral neuropathy, a complication resulting from chronic high blood sugar levels. To effectively manage RLS, it is recommended to keep blood sugar at optimal levels to minimize the risk of neuropathy. Additionally, lifestyle changes, such as reducing caffeine and alcohol intake and engaging in regular, moderate physical exercise, can alleviate RLS symptoms. Additional techniques include leg massages, using hot or cold compresses, and relaxation practices, such as meditation, which are also beneficial for reducing discomfort. 5. Nighttime hypoglycemia. Nighttime hypoglycemia is a critical condition for diabetics, characterized by low blood sugar levels during sleep, which often goes unnoticed. Symptoms include night sweats, vivid dreams, and headache upon waking. If not properly managed, this condition can lead to severe consequences, such as seizures or unconsciousness. Regular monitoring of blood sugar before bedtime is essential to prevent such episodes. Additionally, adjusting the timing or dosage of insulin and other medications is crucial, as per medical guidance. Consuming a carbohydrate-rich snack before bed can also help stabilize glucose levels overnight. It is advisable to keep a source of fast-acting glucose, such as glucose gel or tablets, within reach at the bedside. Educating friends and family about the signs of severe hypoglycemia and how to administer emergency glucose or glucagon injections can be vital for ensuring safety during the night. 6. Sleep apnea. Sleep apnea is a disorder characterized by interruptions in breathing or shallow breaths during sleep, resulting in frequent awakenings. This problem is especially serious for diabetics, as sleep disruption and reduced oxygen levels can worsen insulin resistance and complicate blood sugar control. Often, sleep apnea is associated with obesity, which is a common risk factor for type 2 diabetes. Effective management of this condition includes a combination of lifestyle changes and medical interventions. Weight loss, for example, can significantly alleviate symptoms, as even a small weight reduction can be beneficial. The use of continuous positive airway pressure (CPAP) machines is also common to keep the airways open during sleep. Avoiding alcohol and sedatives, which relax the airway muscles, and sleeping on the side instead of on the back, can prevent airway blockages. Proper management of sleep apnea can, therefore, improve blood sugar control and overall well-being in diabetics. 7. Night sweats. Night sweats, characterized by excessive sweating during sleep, even in a cool environment, are commonly experienced by people with diabetes, serving as a warning sign of nighttime hypoglycemia, that is, low blood sugar levels during the night. These episodes can be triggered by various factors, including the use of certain medications, intensive insulin regimes, imbalances in daily meals, or intense physical activities performed at night. Waking up drenched not only disrupts sleep, but also indicates a concerning drop in glucose levels. To effectively control night sweats, it is essential to regularly monitor blood sugar, especially at night, and adjust triggering factors under the supervision of a health professional who may also need to review medication dosages. Additionally, it is prudent to keep a quick source of glucose, such as glucose tablets or juice, on hand for emergencies during the night. 8. Nighttime cramps. Nighttime cramps are sudden, painful muscle contractions, common in diabetics, predominantly occurring in the legs. These can be triggered by irregular blood sugar levels, poor circulation, or diabetic neuropathy, resulting from prolonged high glucose levels. To manage and minimize cramps, it is crucial to keep blood sugar stable through constant monitoring and strictly following prescribed medication regimes. Practices such as light stretching before bed, especially in the calf muscles, can prevent cramps. Additionally, maintaining adequate hydration and consuming a diet rich in essential minerals, such as magnesium and potassium, is important. Using supportive footwear and applying heat through hot baths or heating pads can also provide relief. If cramps persist or intensify, consulting a health professional is essential to explore underlying causes and obtain treatment guidance. Effective control not only improves sleep, but also strengthens overall diabetes management. 9. Frequent nighttime thirst. Frequent nighttime thirst is a telling symptom in diabetics, especially indicative of elevated blood sugar levels. This phenomenon occurs because high concentrations of glucose in the blood draw water from cells, causing the kidneys to work harder to expel the excess sugar through urine. This process results in intensified thirst and frequent urination, disrupting nighttime sleep. To manage this symptom effectively, it is crucial to maintain strict control over blood sugar levels, which includes monitoring glucose regularly and adjusting medications or insulin dosage under the supervision of a health professional. It is also advisable to balance fluid intake throughout the day to avoid excessive consumption at night, minimizing sleep disruptions. Additionally, reducing the intake of diuretic substances such as caffeine and alcohol can help decrease urine production. Recognizing and treating nighttime thirst is essential not only for diabetes control, but also to ensure restorative sleep. 10. Dry mouth and dental issues. Dry mouth and dental issues in people with diabetes are interconnected with the imbalance of blood glucose levels and their systemic consequences. Initially, dry mouth, or xerostomia, frequently occurs in diabetics due to dehydration caused by polyuria, the increased frequency of urination to eliminate excess glucose. Saliva plays a crucial role in oral health, helping to clean teeth and neutralize the acids produced by bacteria in the mouth. Without adequate saliva production, the risk of dental cavities, gum infections, and other oral problems increases. Furthermore, elevated blood glucose levels promote an environment conducive to the growth of bacteria and fungi, exacerbating the risk of infections such as gingivitis and periodontitis. These inflammatory gum conditions can be more severe and progress more rapidly in people with diabetes, especially if glycemic control is not adequate. Therefore, it is essential for diabetics to maintain good oral hygiene, rigorously control their glucose levels, and hydrate properly to mitigate these risks. Regular dental visits are also crucial for early detection and treatment of oral issues associated with diabetes. 11. Neuropathic pain or discomfort. Neuropathic pain or discomfort in people with diabetes, known as diabetic neuropathy, is a direct consequence of nerve damage caused by prolonged hyperglycemia, that is, high blood glucose levels over extended periods. This nerve damage is one of the most common and debilitating side effects of poorly controlled diabetes. When blood glucose levels are consistently high, they can cause a series of biochemical changes in nerve cells. This includes the accumulation of advanced glycation end products and increased oxidative stress that, together, impair the structure and function of nerves. As a result, peripheral nerves, especially in the feet and hands, begin to lose their ability to transmit signals properly. This can manifest as sensations of pain, burning, tingling, or even complete loss of sensation in these areas. Additionally, poor blood circulation, another common complication in diabetics due to damage to blood vessels, can further exacerbate neuropathy, limiting the amount of nutrients and oxygen that reaches peripheral nerves, exacerbating painful symptoms. Therefore, effective control of blood glucose levels is essential to prevent or slow the development of diabetic neuropathy and its associated symptoms. Regular examinations and careful management of the condition are essential to minimize the impact of this painful and disabling complication. Thank you for watching. Don't forget to subscribe to the channel. I wish you great health, wealth, and happiness. See you in the next video.